This was a great segue, because from this type of cognitive flexibility comes the kind of flexibility that you're going to need to go into the really lovely update in terms of research. We'll have two updates, a clinical research update and then a basic science research update. The first will be done by my colleague, Dr. Emilly Hill, at the University of Cincinnati. Dr. Hill is someone that we're just so proud to have. She's doing all sorts of interesting research studies, and of course, you might recognize her as one of the neurologists we have, and perhaps some of you already see her. We're very happy to have her, and Dr. Hill will introduce us to the clinical research update. Thank you, Dr. Hill.
Thank you, Dr. Espe, and thank you, Sarah, for the brain boost prior to this talk. It's very good to see all of you. I love this event, and thank you to everybody for coming. This is the clinical research update. I'm a physician scientist, so I do both see patients and conduct research. Thank you. So I was chosen for this talk. So I'm going to review some of the things that are the latest in clinical research. As we say, our patients these days are very well educated. You guys are very good at looking at research and asking about research, so my job is to kind of guide you through the latest. I'm going to go over some definitions, talk about some recently published studies, and give a little bit about some ongoing studies. Important definitions to look at research studies are on this slide here. And you don't have to remember all of these, but these are helpful. A randomized controlled trial is the gold standard, the best kind of research study to evaluate a treatment in Parkinson's disease. That's because the placebo response in Parkinson's disease is very strong. So another way that we talk about that is a double-blind, placebo-controlled trial, meaning half of the people get the drug and half get placebo, so that we can tell if any improvements were from the placebo response or if they were from the drug. There's the phase 1, 2, and 3 studies. So usually when we're presenting the newer ones, a lot of them are phase 2, where safety has been established in a human population, but now we're looking, is it both safe and does it have some efficacy? And then the phase 3 is the gold standard before it becomes approved for many of the drugs, where you compare it to the current treatments. Our MDS-UPDRS is our main outcome when we're looking at the motor symptoms. So that's the exam we have you do in the clinic. That gets a number score. And I tell my patients it's like golf. You want lower numbers. And so if we see numbers get lower or stay low, that is what we're looking for. And then dyskinesia, many of you are familiar. These are the extra wiggly movements when medication is on, and some of the trials are going to discuss the presence of dyskinesia and the presence of dyskinesia that bothers someone. I reviewed this last year, but I just added it back for this year because at least one of these is still ongoing. They're doing some open label extension. But these are the anti-alpha synuclean drugs. This is sort of a research path that people are going down, trying to blast the abnormal proteins, they say, in the brain. Alpha-synuclein is seen in the neurons of people with Parkinson's disease. And so one of the trains of thought was if we get rid of it by having the immune system attack it, maybe that would be the way to improve symptoms. That turned out not to be true. And so these are the studies here showing that there was no difference. What we're looking for is for these lines to separate. These are the changes in the symptoms from the UPDRS. That's that exam, like I said. They also include part 1 and 2, which are symptoms, subjective symptoms. And so these lines stayed parallel, so there was not a response. And then this has an open label extension, meaning open label means it's no longer a secret who is on the treatment and who's on placebo. Everybody just gets the treatment and without the placebo being controlled for. And so that's going on through 2024. We have not heard any updates yet, but maybe by next year I'll have updates. Another form of delivery for the medications is a continuous pump of medication that goes in the skin. We have the pump that delivers levodopa into the intestine, the duopa, but this one, for example, we have the apomorphine shot, which some of you may be familiar with. You can give a shot of a medication that looks like dopamine to the brain, and that has a quick on and is very helpful for some people. So this was taking that a step further. Could we give the medicine through the skin in a continuous way rather than having that up and down that we have with the pills? They tested both levodopa, which is the active ingredient in Sinemet, or Carbidobolivodopa, and then also the dopamine agonist, which again sort of tricks the brain into thinking there's dopamine there. So this is showing that the apomorphine infusion was helpful. It's actually already available in India, so that's a little picture there of an advertisement for the drug there. But this was just showing that after this study was no longer blinded, people did well. They're looking at how much time people spend in the off state. So that means when the medication is not working, again, we're attacking these fluctuations. Medicine's on, I feel good. Medicine wears off, I feel bad. Trying to reduce that amount of time that the medication is off. And then again, they make this distinction of troublesome dyskinesia, because many people have extra wiggly movements and they don't notice and it doesn't bother them. And we are able to move and do what you want, then it doesn't bother us. And so the amount of on time without troublesome dyskinesia also increased by about 3 hours. And then this one I like, this is, do the patients like it? And the majority, about 68%, said that they were much to very much improved on this treatment. And again, this was just showing, this was new this year, but showing that after the 12-week initial study period, when you extended that out to a year, people were still happy. So that is something that's important. And this has now been submitted to the FDA, and they've asked for more data, last I saw, but they did not ask for new studies. So that's promising that this treatment could be approved soon. What I have down here is a picture of skin nodules. This is one of the side effects of this medication. Putting the medicine in the skin can sometimes irritate the skin. So you have to rotate where the injection goes in or where the infusion goes in because of that side effect. But if people can handle that side effect, they tend to like it. Now this is another one from 2022, just looking at the other form of medication going into the skin. This is our friend Carbidobolivodopa in another form that's going into the skin. 24-hour-a-day continuous infusion. So we're thinking of this for our people too, again, with the on and offs, and I think of this too for people who are off overnight, and it's really hard to get up and go to the bathroom, for example, when you're super off, and so this is a treatment that could potentially be really useful. What I have here is a significant increase in the on time. Significant in the science world means how likely was it that this was just by chance, that one group did better than the other group. It was very not likely that this was just by chance because of this number. If it's less than 0.05, it means it probably wasn't just chance. So this one's pretty low, so that's good. So the increase again in on time without that bothersome or troublesome dyskinesia, and then less of the off time. So in the graph here, for those of you who can see it, that green time is on time without dyskinesia at all, and then the blue is on without bothersome dyskinesia. So I kind of grouped those together. And you'll see that the infusion had better or more green and blue than just the pills. And so that was a real promising finding. And so this is another one that has been submitted to the FDA. Again, they asked for some more information, but have not asked for additional research studies to be done. So promising that this one could also be approved soon. So then it'll be a question of who's a candidate for which one based on potential side effects, probably. Moving on to another new form of treatment. This is the focused ultrasound. So this is, I say it's like making a tiny burn in the brain for the bad circuit is what I talk about. That's sort of how I think about it. The deep parts of the brain that control movement automatically, sometimes they get kind of in a loop and they're in a bad loop. So you can create a tiny burn to break that cycle. Back in the day, we used to do surgery on this part of the brain and just remove a tiny piece of it. Now we have deep brain stimulation, which you heard about earlier, where we can use electricity to disrupt that bad circuit. And then this is a tiny burn. And so this has been studied in essential tremor quite a bit. And then there was a recent study that came out this year about using it for Parkinson's disease. And that deep part of the brain, the globus pallidus is the name of that part of the brain. So this was showing that in the people who had the procedure versus, it's called a sham procedure. So you can't really do a placebo where you say you get this complicated medical procedure and you guys don't, and we'll just compare the two groups. You have to pretend to do the procedure to see if there's a placebo response. And so that's what a sham procedure is. So they pretended to do the procedure and put the whole MRI thing on and everything. And anyways, so at 3 months, some people had response to the pretend procedure, but by 6 and 12 months, they did not. So the focused ultrasound, again, improved response. Response, again, was improved motor symptoms, so lower MDS-UPDRS score, or less of the dyskinesia, the extra wiggly movements we see when the medication is working. So that was promising as another advanced therapy for people who maybe don't want brain surgery. This, I like to just include a list of things that we're doing at UC, research that we're actively involved in. And so there's a list here. We're doing the exercise in Parkinson's disease. Exercise is medicine in Parkinson's. We have a mechanism for why it works. It increases chemicals that protect your brain. And so we're looking for people who have not yet started treatment to see if they're candidates for this exercise program. We're looking for people who are at risk to fall as well, because we have a treatment to protect the bones. People with Parkinson's disease tend to have a higher risk of bone fracture when they fall. And so this study is giving an osteoporosis treatment to prevent fractures for people who are at risk to fall. And then some other ones here looking at a wearable device to see how well the deep brain stimulator is helping people. And then racial disparities in Parkinson's disease care, that's one that I'm involved with, trying to understand the differences between our rates of Parkinson's disease in different racial and ethnic groups. PPMI 2.0, this is the Michael J. Fox Foundation study, we're involved in that as well. And then, of course, our CCBP is our answer to that study as well, looking for other novel biomarkers for personalized medicine. And then we're always interested in genetics. So we're looking at genetic studies to try to understand better some of the other risk factors for several movement disorders. So in summary, the anti-alpha synuclean, that's having the immune system attack the protein that we see in Parkinson's disease. Those trials were ineffective, but people are still waiting to see if one more year will find an effect, but we're not thinking it will. The skin delivery systems are promising and probably will be approved soon. So for people who have big time fluctuations or really bad overnight off, this is something we could consider. Focused ultrasound is being explored. That's a new study, that one I showed you for focused ultrasound. That was, within a few months. And then the research we're doing at UC is hoping to find new therapies and new ways of thinking about Parkinson's disease and the related syndromes. So that's all I have. Thank you.